The United States is one of the wealthiest countries in the world, yet it faces a persistent shortage of doctors. Millions of patients, especially in the rural or low-income communities, depend on just foreign-trained physicians to access the basic health care. Among these, Indian doctors form one of the largest groups and play a critical role in keeping the US healthcare system running smoothly. Experts estimate that nearly 1 in 4 doctors in the United States is foreign trained. This means they earn in medical degrees outside the country, and today there are around 2 lakh to 3 lakh foreign born physicians practicing across the US. These doctors are not evenly distributed. They are far more from the common in primary areas and the underserved regions, where the US trained doctors are less likely to work. In some areas, foreign trained doctors make up half or more of all the practicing physicians. In the regions where per capita income is below $15,000, 42.5% of the doctors are foreign trained. Many of these physicians specialize in family medicine, internal medicine, and pediatrics. These fields form the backbone of the primary health care in the US. Without these doctors, rural parts of the South, Midwest, and the unreserved regions would struggle to attract enough physicians to meet the patient's need. Now comes India. India is one of the leading source countries for doctors in the US. Recent data suggests that around 80,000 to 1 lakh Indian doctors practice in the country, and this makes them one of the largest foreign-born physicians group. Indian doctors are highly valued, they are trained, they are experts, and their willingness to work in the less popular specialties or the locations where domestic guards are fewer makes them special. There are the several structural reasons why the US relies heavily on the foreign trained doctors only. The demand of the physicians has grown because of an aging population and the rising rates of the chronic disease. However, the numbers of the residency positions in the US has not expanded fast enough to meet the demand. Many qualified US doctors and the graduates face barriers to obtaining resident slots, forcing hospitals to recruit internationally. Even when the total number of the US trained doctors increase, many prefer high-paying specialties in the urban areas. Rural and unreserved communities continue to rely predominantly on the external medication graduates. While these are the international doctors coming from other countries, predominantly from India. Projecting suggests that these doctors are foreign-born and practice in US and may grow unless the medical training and recruitment expand further. Foreign-trained doctors are also more likely to serve in the communities with limited healthcare options, while rural hospitals and the intercity clinics depend on only them providing primary care, preventive services, and specialist consultations. So if the immigration reforms or the visa restrictions make it harder for the doctors to enter US and practice there, while wait times could increase, clinics could close, and access to healthcare, even the basic one, could worsen, particularly for the low-income Americans. India itself produces a large number of doctors with 70,000 to 1 lakh MBBS graduate techs every single year. Despite this high output, distribution of the healthcare systems in India is also uneven. Many graduates look for abroad, better opportunities, better career, and the US system benefits from it. The skills, the structure, weaknesses of American healthcare, including all of that limited residency slots and uneven distribution of the physicians, making foreign doctors undisposable. Well, all in all, in the end, just to summarize my whole point, Indian doctors help fill the critical gaps in the US healthcare. They provide essential care, unreserved areas, they work in there, contribute to primary and specialty care, and support the healthcare system, a system that struggles to meet the ground reality. Well, their presence ensures that millions of Americans receive timely medication, attention, and highlighting the importance of policies, and allows skilled immigrant physicians to continue serving communities across the country. And that is why I said, US healthcare system depends heavily on just Indian doctors. Your opinions might differ from it. Make sure to comment down below.